This video is for basic facial, and we start as if we just arrived to work. So first things first, we're going to be washing hands. Hopefully my video, it's going to be okay. Okay. So we go to the sink, we wet our hands, and we find a coin-size amount of liquid hand soap. We wash our hands down to our wrist, and we wash the back of our hands down to our wrist. We wash our fingers, and we wash the back of our fingers. We wash our fingertips and our nails, and we wash between our fingers and our thumbs. We are going to wash our thumbs, we are going to wash our wrist, and we're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And then we give everything a good, thorough, proper rinse under the sink. When we feel like we've gotten it rinsed, we grab either disposable paper towels or a towel. We turn off the faucet. We dry our hands off completely. Paper towels, if you used to go in the trash, if it was a towel, it's now dirty, and it goes into a closed container until time to do the laundry. And then we're gonna grab our 70% ethyl alcohol hand sanitizer, and we're gonna sanitize our hands. And we are going to do all of that same motion while we use our sanitizer. Once we sanitize, we need to get our room ready for our client who's coming for basic facial. And we always do everything we possibly can ahead of time to be on time for our client's appointment, but also to be incredibly professional and respectful of our time and their time. So we have a packed day, they have a packed day. You need to do everything you can so that that time really is devoted to service for the client and not getting ready to do the service. So we've learned what to do ahead of time and how to maintain that level of professionalism. And one of those things to do is to prepare for your appointment. So the first thing we're going to do in our room is we're going to disinfect our workstation, bed, and equipment using a disinfectant wipe following manufacturer's instructions. We're going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We're going to gather clean supplies needed for the facial service, storing in a clean closed container. We're going to turn on the hot cabbie and stock it with at least 3 clean wet towels. More may be needed depending on the service and the client's needs. We will also fill a clean steamer glass with distilled water and preheat the steamer. We're going to dispense products needed for the service according to skin type and client's needs as follows. We will prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or we can remove the product with a disinfected or clean single-use spatula. We'll close the lid to the product and set the portion cup tray on the tray. We're going to drape our facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on a disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel along with a rolled towel to support the head and neck of the client, and save the third towel to lay across the client's décolleté. So we've already prepared all of the bedding. What we need to do now is just review with you what we have on our tray for the service. So of course we have makeup remover, we have water, we have toner, which toner is actually in the spray bottle. We have cleansing product, we have exfoliating product, we have a mask, we have massage product, we have 4 squares, we have 2x2s, we have cotton rounds, we have wooden sticked Q-tips to perform extractions with. We have a brush to apply our mask with. We have single-use disposable items to scoop out our product as needed. Of course, we have disposable gloves that we'll be using for extractions. We have eye cream, we have moisturizer. We have all the things that we would need to take care of our client. The only thing is that we haven't actually dispensed the type of cleanser, moisturizer, etc., because we don't know the skin type. We don't know all the details. So we have to figure all of that out during our client consult once they arrive. And we'll really talk about that in detail now as we get to that point. So just one note, before we meet our client, just know that we are going to be always meeting our client with clean, fresh hands. I'm just not going to wash my hands right now because I'm going to wash them again before I start the service. And just bear with me as I have a little tea here during this video. I feel great. I just have a little tickle in my throat because I have to talk the whole time felt like hot tea would be a nice soothing thing to drink while doing the video. So I'm approaching my client for that client consult because she's just arrived right on time for her appointment. So we're going to review what happens in that client consultation time. So you're going to greet your client and escort them to their work area. You're going to determine the client's preferences and assess the client's needs. You'll assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. You'll assess, we're going to go into detail with this in just a second too, just reviewing the contraindications. You're going to assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. You're going to consult with the client on any facial surgeries within the last 3 months, and if a client is under a physician's care. You'll assess if the client is prone to cold sore or fever blisters. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. You will assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And so just breaking those down, obviously when you're communicating with a client, you can only look with your eyes at that point. You're not doing your professional skin analysis. So you have to make sure that you don't see anything wrong on the surface, but then you have to communicate deeper with this, which is why they've filled out further. So you look at their medications or what they've done in the past 72 hours. You obviously want to make sure that they haven't had any kind of treatment or used anything topical that would make them extremely sensitive to what's getting ready to happen. You want to make sure they haven't had any filler, because you can't do it then, and they don't have any open or prone to cold sores or any open real cold sores, because you can't do the service on that, highly contagious. You have to make sure that they're not on any medicine that could either thin the skin or make them have some kind of adverse reaction. And you want to make sure they've told you about any allergies that they might have, because if there's an ingredient in a product you're using that they're allergic to, you don't want to do that and you need to edit that. So this is a time for you really to make those good detailed notes. And if you don't know something, you take the time to look it up, because you want to make sure that you have a very happy client, a repeat client, and that you're giving them the best possible service. So if there's something you don't know, now would be the time to find out. And then once you've finished all of that, thankfully our client does not have any contraindications whatsoever. You're able to move forward with the service. And so you're going to get your client very comfortable. So you're going to get in, take her into the treatment room and then give her some privacy so that they can change into the drape and everything that you've left for them. So that's what you're going to allow them to do. So you leave them, you close the door, you allow them to change and get into onto the facial bed, and you'll come back and make them more comfortable. So you feel like you've given them enough time. You come back, you knock on the door. They'll let you know when it's time to come in. Our client is great. She's already on the facial bed, so let's make her more comfortable. We've got a rolled towel here that we're going to place underneath her neck for support. We have a nice headband here that we're going to hold the hair back from her face out of the way so you can perform the service. And then we have that extra towel that we're going to take across the décolleté just to give her a little more coverage here. And once you confirm that she's comfortable, you can go wash your hands to get ready to perform the service. So we're going to go to the sink and wet our hands, get everything nice and wet, and then get that liquid coin-sized amount of liquid hand soap, and then go ahead and wash your hands together down to the wrists, and wash the back of the hands down to the wrists. You're going to wash your fingers. You're going to wash the back of your fingers. You're going to wash your fingertips and nails. You're going to wash between your fingers and your thumb. You're going to wash your thumbs. You're going to wash your wrists, and you're going to do all of that wash, interlocking wash, for a minimum of 20-30 seconds. When you finish that 20 and 30 seconds, you get to rinse under the water. When everything is rinsed properly, you can either grab some disposable paper towels or a towel, and with the towels, you turn the faucet off. Dry your hands completely. Toss the paper towels in the trash. If it's a towel, go ahead and put it in a closed container until time for laundry, and then get that hand sanitizer, 70% ethyl alcohol, and you're going to sanitize your hands. You're going to do that before you can start the service. and you're sanitized properly. Now you can begin. So you're going to go over and remove her makeup first. So we're going to get some makeup remover. And every client's different. Some may wear more, some may wear less. And we're going to remove makeup. Then we're going to do our first cleanse. And then you can go ahead and remove that first cleanse. And then after that first cleanse, you're going to need to protect your client's eyes. So what we're going to do now is cover up our client's eyes, because we're going to be bringing in a bright light, and we're going to tell him or her that we're going to be covering up their eyes because we're bringing in a bright light. And this is where you get to do your professional skin analysis. So taking a minute here to get that good coverage, and then I don't have a magnifying lamp, so we're going to bring it in, turn it on, and then you're going to take a really smart amount of time, depending on if it's your new client or existing client, on what you're looking for, and you're going to look at the neck and all over the face, and you're looking at different things at different things at different places of the face. But if it's your first time, you really need to give it a really good, proper overview. So you're going to be looking at the chin, you're going to be looking at the cheeks, maybe pore size, maybe excess sebum or dehydration. We could be looking for things like hyperpigmentation, redness, capillary issues, fine lines and wrinkles, all the things that we need, texture, that we need to be reviewing. We're looking for freckles, we're looking for moles. Now maybe it's because of what our client has told us his or her goals are for their skin, or what they feel like they're struggling with. This is the time to really get in there and see if that's true or not. The other thing is that as their skincare expert, you're making all of your professional recommendations, but you need a really good overview of what this is going on with the skin every single time you treat your client or service your client. So you need to be notating everything about the skin every time, certainly if there are improvements, certainly if there are challenges. And then also, you're the person that can probably see in the magnifying lamp, or depending on what you're looking for, Woods lamp, if there's been any changes to something like a mole or a freckle that you feel like is out of your scope of practice, and you have some recommendations for maybe a physician or someone to refer them to. You really need to be keeping great records. So whether it's your client card or your software system where you write about your client, you need to make sure you're doing that for every client, for every appointment. And then beyond that, you need to be looking for areas that they may not know about, that you can help them achieve their goals, and your goals together, whether it's services and or at home care regimen, because you know that the client is at home more than they are with you. So what they do at home will amplify this result or sabotage these results. And so that's where you really talk through products that you recommend, and then obviously talking through things of service, and then what priorities are for each client. And that may of course be different every single time and every single visit. So this skincare analysis is not to be rushed over. It's definitely something where you're going to get to see with your very own eyes, from a professional standpoint, the specifics that you're looking for. So you've done that, you've turned the light off, you've gotten the magnifying lamp or Woods lamp out of the way. Now you can remove this. Excuse me. And then we would be going in for cleanse number 2. And now you can go in and remove that cleanse number 2. And then third and final cleanse. And everyone may not need 3 cleanses, but they definitely need 2. So just gauge it on a case-by-case basis on what you think your client needs. And now we're going to remove that cleanse number 3. And then once you're fully cleansed, you can tone. So I'm going to take 2 of my 2 squares, and I'm going to spray toner on it, making sure to avoid the contact between my spray nozzle and my squares. And then we are able to move forward, which the next thing we're going to do after we tone is exfoliate. So we're going to take about a pea-sized amount of exfoliant, and we're going to spread it out across the face and neck. And then we are going to obviously read and follow our manufacturer's instructions, but we're going to massage this exfoliant in for 1 to 2 minutes. So just note here that there's physical exfoliants, there's chemical exfoliants, so you're going to decide what you're using based on your client, and you're going to then do the next step accordingly. So we're just massaging in for 1 to 2 minutes, avoiding the nose, the eyes, and the mouth like we do with each part of the facial. And once you have finished massaging that in, I'm going to read through the next steps because I do not have the equipment. So I just want to review what would happen. You would retrieve the facial steamer and turn the steamer on. So that's what we put the distilled water in when we were doing the preheating, setting up our room. We'll position the steamer next to the facial bed and make sure that it's facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, position the steamer 16 inches over the client's face and aim it at the client's chin for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Remove the steamer from the client's face, return the steamer to its previous location for disinfection. So walking through that, we bring the steamer over close to the facial bed, and then we turn it on, making sure that the mister is not facing the client so that it warms up and then it hits that even outflow. And then we'll turn it towards the client's face. We're going to aim it to the chin about 16 inches away and let it mist evenly across the face for 3 to 5 minutes. We're obviously not going to do that timed now because we don't have it, and also we're doing a video, so no need to do that. So we're going to go ahead and pretend like that 3 to 5 minutes has elapsed. We're going to turn off the steamer, turn it away from the client, and then, turn it away from the client, then you can turn it off. And then return it to where you retrieved it from. We're going to disinfect it later after the service is finished. So we're going to now remove the exfoliant, and I also do not have a hot cavity, so I'm going to pretend like I do. So I've got my nice steam towel here I'm retrieving out of my hot cavity, and I'm going to test that temperature on my wrist because I don't want it to be too hot. And then I'm also going to test it on my client's collarbone when I feel like it's safe. She thinks it feels great. So we're going to take a nice gorgeous steam towel here and place it across the client's face, leaving the nose out. And that way she can breathe. And we will allow it to sit for about 20-30 seconds. You have to keep in mind that you'll start to feel this steam towel cool down, and you don't want to leave a cold towel on a client's face, maybe not very comfortable. So as it starts to cool down, you'll know, and then that would be the time to go ahead and remove the exfoliant. So go ahead and remove the exfoliant with your steam towel. Make sure you're getting it all off. There's some on the neck too. Don't forget about that neck area. And at this point, you want to make sure that you have really, really, really dry hands. And the reason for that is you are going to perform extractions if your client requires that, and she just has a couple. And in order to perform extractions, you need to be putting on a pair of disposable gloves. So it's very difficult to do if you have wet hands. So I've got some disposable gloves right here, and I'm going to put them on. And there's a couple ways you can perform extractions. You could take a couple cotton rounds, you could soak them in astringent, you could place them around your fingers, and you could perform extractions and then turn them and work your way around the cotton round until they're dirty, and then toss them, until it's completely used and toss them. I'm actually going to use the wooden stick Q-tip version. She does not have many extractions at all. We're going to soak the end of the wooden stick and the Q-tip into astringent, and then once you remove it or perform an extraction, you'll toss that in the trash. So that's what we're going to do. She just has a little bit around the nose that we're going to go in here and take care of. Oh, and note to self, you may be bringing the light over to do your extractions, so you may want to go ahead and cover your client's eyes with cotton rounds if you need to turn that light back on. I don't have a light, but that's probably what would be happening at this point, so you want to make sure you're giving your client coverage again. All right, so let's perform this first extraction. Then we're going to toss these Q-tips. And you don't want to perform extractions any more than 5 to 7 minutes, especially on a client that maybe needs a few more than less, because extractions can be uncomfortable, as we all know. It can be somewhat painful, and so we don't want that client to deal with pain. She's got one more I need to work on. So make sure that you are mindful of her comfort, and you're checking in on that all the time. Making sure she's comfortable. Last one. And then you can take off your disposable gloves and throw them in the trash because you won't need them. Obviously, you would never reuse them after extraction, so time to toss them. And then you will go ahead and tone again. So once again, as I retrieve my 2 squares, I am going to make sure that there's no contact with my spray, toner, and my 2 squares. And then once you tone, it's at this point you get to go into the massage portion. So This is a very relaxing section. The only time you would not be performing massage is if someone had severe acne. That would be a totally different type of facial. And there's certain things that you would want to do and not want to do, massage being one of them that you would not want to do. You don't want to spread any bacteria or cause any more of a breakout. So we're going to go into that step now because our client is not suffering from that grade of acne. And we are going to make sure that we retrieve our massage product and we don't go back in, retrieve anymore. We don't want to stop and start a massage. So when we start, we want her to be able to relax or him to relax and enjoy it. So our hand should not leave the client until you're finished with the massage. So you may want to just, spread a little bit of your massage product out before you start the massage, making sure that you have enough. That way it gives you an opportunity to go back into that massage product if you need to retrieve any additional before you actually start massaging your client, so they can truly enjoy this section and relax throughout. to remove your massage product. And after you remove your massage product, you will go back in now with a mask. So you would obviously select a mask that you've already planned according to your client's skin type, etc. So you would follow manufacturer's directions for that as well. I'm going to use my fan brush to apply the mask. And just like all the other things we've been doing so far, we are going to apply our mask, avoiding the eyes, the nose, and the mouth. And then, of course, that being said, depending on the client's skin type, the type of mask you pick, manufacturer's directions, etc., mask will stay on for all different timelines. We're going to say this one from anywhere from 5 to 10 minutes based on our client's needs. Now, because we're doing a video, we're going to go ahead and pretend like those 5 to 10 minutes has elapsed, and we'll be able to go ahead and then remove that mask product. And once you have removed your mask product, we're going to do that final tone. So what I'm doing here is just finishing that mask removal. toner, 2 squares, obviously avoiding the nozzle. And then once we have completed the toner, we're going to apply her eye cream moisturizer serum, possibility there as well if you wanted to add that in. I'm going to go ahead and do a little eye cream. And one thing to note here is that I'm going to take a tiny bit of eye cream. You won't need a lot. I'm going to apply it with my ring finger. So I'm going to rub those together. And then I'm going to do light tapping motions on the zygomatic arch and the brow bone. And then I'm going to be applying a moisturizer that has an SPF, definitely a physical block. It's a gorgeous sunny day, even though it's a winter day, not quite winter, but almost winter, after Thanksgiving weekend here. So we're going to apply some moisturizer with the sunscreen, once again, that physical block. We've already pulled that moisturizer to review with her when we're done with this with sunscreen, because we know what an important step that is every single day. So I'm hydrating her, and I am making sure if there's anything that's going to be exposed, neck, décolleté, ears, if she has a shorter hair, any area we possibly can, we are adding that moisturizer with SPF. Of course, she would just need it in the daytime, different one at night, and of course I'm going to give her a little lip hydration as well. We always want to have those lips looking great when we finish the facial, and for them to feel as moisturized and beautiful as the rest of her face does. And her skin looks gorgeous. And so this is a first-time client, so we're going to present her skin, and she is just in awe. She's like, oh my gosh, look amazing. So that's great news, which we knew that anyway. So we're going to give her some privacy and allow her to change back into her clothing and meet us at the client consultation area, where we're going to review maintenance and aftercare. And she is a new client, so this is a really important step, because we did go over very specific goals, and we figured out her main reason for coming in for that basic facial. And for her, she just has felt like she's starting to see those first signs of aging. She's really, really dull. She feels like her skin is really dull, maybe possibly dehydrated, and so she just needed to pick me up. And then she's really just feels like, because she is starting that to feel like she's going through some anti-aging, some changes because of that, she doesn't want to know what to do anymore with her skincare at home. So this is where we're going to take that really conscious effort and time to go over that daily routine and why we chose what we did in the facial, and kind of mirroring those steps of importance throughout the week at home, and knowing that we can get her set up with some great support at home with that regimen, but also we're going to get her in for a nice little series of booking set here, so that we can really achieve some of those goals that she wants to achieve before Christmas, which is 4 weeks away. So she is definitely on board. We've got her rebooked, and we're sending her home with her aftercare kit and her products for daily use. We get her checked out, and then we need to get back to our room, because we've got another basic facial coming in. Everybody's wanting to look their best for the holidays, so we've got to get that room ready so that we stay on time and on task. So the first thing that we want to do when we get back to our room is find any single-use items and toss them if we haven't already, like those wooden stick Q-tips, etc. And then we're going to strip the bed of all the linen that's dirty. We're going to put it in a closed container with those dirty towels and everything, with a lid, until we're going to do the laundry later. We're going to get any dirty implements, maybe like that brush, if there's anything else that needs to go dirty implement wise, into a closed container that is labeled to be disinfected. And then we're going to identify our proper cleansing agent. We're going to read and follow manufacturer's directions for mixing and usage, and then we're going to wipe down our workstation and area to rid it of any dirt and debris. Then we're going to locate a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting, which means we've got to get another pair of disposable gloves to put them on, because we're going to read and follow manufacturer's directions for mixing and or using aerosol disinfectant, and you have to have gloves on for that. So you're going to do all of that, and then you're going to get any kind of electrical equipment like the steamer, and you're going to disinfect that as well, following all those directions, and then relocate it to an area where it is not going to come into contact with anything that could hamper that disinfection. So you're storing it in an area away from other implements. Then you could remove those disposable gloves that you put on for the disinfectant, toss it, and it's time to wash your hands one final time. So you're gonna go to the sink, wet your hands, get that coin-sized amount of liquid hand soap, wash your hands down to your wrists, and then you're gonna wash the back of your hands down to your wrist. You're gonna wash your fingers, and you're gonna wash the backs of your fingers. You're gonna wash your fingertips and your nails. You're gonna wash between your fingers. You're gonna wash between your fingers and your thumbs. You're gonna wash your thumbs. You're gonna wash your wrists. You're gonna do all of that interlocking washing for a minimum of 20 to 30 seconds. And when you feel like you've gotten that done, you can give it a thorough, proper rinse under the running water. Grab disposable paper towels or a clean towel. Turn the faucet off with the towels. Dry your hands off completely. Towels go into the trash. Paper towels go into the trash. If it's a towel, it's now dirty, and it needs to go into that closed container with your other dirty linens until you wash. Grab that hand sanitizer, 70% ethyl alcohol, and then follow suit with the same process of movement for cleansing the hands with the hand sanitizer. And then that would conclude your video for basic facial, and you can get back to setting up for your next client.